Hi there, would you like to tell us a little bit about yourself?
Yes, my name is John Bosomworth. I'm a retired family physician, rural family physician. I worked in Princeton, BC, and did family practice there.
And why do you attend the Rural and Remote Conference?
I'm here primarily because I give talks to rural doctors about certain topics, and I've been doing that for a number of years.
And what was your topic about at this conference?
Well, one of the topics, and the one that you perhaps would be most interested in, would be a combination of problems, including knee osteoarthritis, obesity, and exercise, and how those three factors kind of operate to determine whether the patient is going to have a quality of life that's reasonable or not going to have a quality of life.
Okay. And so do you have a specific story or that you talk about during your lecture or anything?
Yeah, well, the thing that got me interested in the topic in the first place was a man that my wife and I met at the top of the Alps in Germany. We had come up this mountain on what's called a Kletterstieg, which are a series of iron ladders, and we had ascended the mountain 1,500 meters, which is a good day's work. And when we got to the top, about the same time, a man who I would call Herman introduced himself, and the interesting thing about it was that Herman weighed about 300 pounds, and Herman was probably about 70 years old, and he had come to the top of Alpspitze on his own, and he didn't look at all distressed. And when we talked for a bit, he did allow that on his way down he probably would have to take the lower lift back down to the lodge because he had a bit of trouble with his knees. And I thought that was an interesting combination of problems. Here was a man who was quite elderly, quite overweight, quite fit, and still had knee arthritis. And I thought I would probably look into the combination of those problems and see what I could come up with.
So when you're having your talks, is there a key message or key concept that you are trying to get across?
I think there are a number of key concepts. One is that osteoarthritis, of course, does present a problem with mechanical loading of the knee. But there is another aspect to this, in that osteoarthritis is probably not strictly a mechanical and wear and tear condition. It is probably also an inflammatory condition, and by that I mean that there are demonstrated to be inflammatory compounds produced by fat tissue, by fat cells, and that these fat cells are very metabolically active, and systemically through the person's systemic circulation, and locally as well through fat that's adjacent to the knee. These inflammatory compounds can actually act on the joint as well, making the symptoms worse. Therefore, people who are heavy can have more trouble with knee arthritis because of their heaviness, not just because of the mechanical part, but because of biochemical problems. We know that heavy people also have a very much increased incidence of hand arthritis, and that obviously has something to do with mechanical loading. We also know that exercise can reduce inflammatory compounds in the circulation, and it's been demonstrated without any question that exercise for people who are overweight or for people who are not overweight is beneficial with knee arthritis. It's not that it will reduce the likelihood that their arthritis will progress. It will reduce the symptoms that they have as they go on in life, and it will improve their quality of life because they are able to exercise better. We also know, as it happens, that factors of diet increase inflammatory compounds in the blood, and particularly our Western diet seems to be a problem with inflammatory compounds, and that the Mediterranean diet probably is a vast advantage in this regard. The other thing that I liked to point out was that these improvements with diet and exercise can happen without weight loss. In other words, there needn't be a necessity for a person to lose weight in order to improve the knee arthritis symptoms. Taking the load off is certainly a big help, but everybody knows how hard it is to lose weight. If a person changes their diet and improves their exercise habits, they will be able to improve their knee arthritis symptoms without any weight loss.
Well, thank you very much. That's very interesting.